I'm Jim Cruiser, Kenosha County Executive. Every day, great things happen in Kenosha County. And this newly expanded COVID-19 Vaccine Center, we are excited to celebrate its opening just a few days ago, and we're especially glad that Governor Tony Evers is here. Thank you, Governor, for everything you're doing. With this facility now online, Kenosha County is ready. We have the infrastructure and the logistics in place to put tens of thousands of shots into people's arms. So, Governor, when the federal government releases more vaccine, Kenosha County is ready. Kenosha County's been a leader early on. We were able to give up to 1,000 shots at our other on-site clinic at Human Services. And here we have given 2,400 2 days ago, and it'll be another 2,000 today. So we're doing great. I mean, how do you have the count yet? But that's the estimated. So we are glad that we have been a leader in one of the first getting these out. And kudos to the health department, the volunteers, the other employees, and Dr. Jen Freiheit. It's the people that make a difference, and we've had a lot of great people just helping us make these clinics go seamlessly. We have Dr. Jen Freiheit, John Jansen, the Human Service Division Director, have just been spectacular in the planning, organized, directing, and staffing. We care about the individuals and the businesses affected by COVID-19. We want to fully reopen our economy, but we want to do it quickly and safely as possible. This clinic and getting our county to herd immunity will help us get there and is the top priority of Kenosha County government. So with that, I want to introduce my other friend, John Antaranian, the mayor of this fine city. Mr. Mayor.
Well, welcome everyone. Governor, thank you very much for your leadership and everything you have done to make sure that the people of Kenosha County and the state of Wisconsin are getting their shots. I also want to thank the county executive, who has done an excellent job, along with Jen, to make sure that everything has moved smoothly and this community is well protected. I want to also make sure that I thank all the people that are here, all the employees, all the volunteers, everyone who has come to make sure that we have a better health system for Kenosha County and the state of Wisconsin. So again, we're looking forward to opening up our community on a safe way, and that's why we're working with the county as to how we are going to be doing this. So with that, I just again want to say thank you to all the people who have been helpful in this. We're looking to get the economy rolling again in Kenosha County, and we are looking forward to the support from the state and again to the county executive for all of his hard work. And at this time, I'd like to introduce Jen Freiheit, who is the Dr. Freiheit, I apologize, the head of the health department, who has done an excellent job along with all her staff in making sure that Kenosha County is safe. Doctor?
All right, thank you to Governor Evers for visiting us today, and thank you to all of our elected officials as well for seeing this great new resource that we're excited to offer to all of our residents of Kenosha County. We're proud of what we've already accomplished in vaccinating many of our residents and people who live, work, and study here, but we're not just resting on our laurels. This clinic facility will allow us to move to that next level. In our former facility at the Kenosha County Job Center, we were able to vaccinate approximately 1,000 people in a 6-hour clinic. This new facility will allow us to vaccinate up to 2,300 and even higher in this new space. And as we get more established in this space, we'll be able to vaccinate many more when we get more vaccine. We, at our former space, had 11 vaccinators, And at this new space, we have 25 vaccinators. We had 4 registration tables at our former space, and at this new space, we have 12. So you can see we are more than doubling capacity, ready to move as quickly as possible when more vaccine comes. And this space also allows us to social distance more properly with chairs 6 feet apart and plenty of space to stage people. We are now in a great position and to achieve our herd immunity goal of 75%, which is approximately 127,500 people for the county of Kenosha. We are also very grateful for our COVID-19 Equity Task Force, who we have several leaders here today from the Shalom Center and the Mahone Foundation. They are really helping us and directing us into how we can better reach our most vulnerable populations here in Kenosha County. So I want to thank all of the public health staff. The health department has an awe-inspiring and amazing crew. All of the county employees, the volunteers, so many people it took to put this together that have been an amazing, amazing team. So thank you to all of them. Thank you to County Executive Cruiser from a year ago when we first sat down and decided what we need to do moving forward. The support for public health has been astronomical. So thank you very, very much. Thank you. Mayor Antaramian as well, the support and the teamwork, the collaboration, couldn't have asked for working in a better county. Thank you. And thank you to Chairman John O'Day and all of the county board supervisors that have really helped us and stuck with us in this very rough and difficult year. Thank you very much. And last but not least, thank you so much to Governor Evers and the Department of Health Services, who have really been very supportive, daily phone calls, helping us with the resources we need so that we could pull off this amazing endeavor. So with that, thank you. I'll introduce Governor Evers. Thank you.
Thank you, Dr. Freiheit, and thank you for your great work. And I'll talk a little bit about the importance of public health towards the end. But first of all, I also want to recognize state representatives from the area. I know Representative McGuire, Onstead are here, along with Senator Wirtz. Thank you for all your support. And I know the favorite son of Kenosha, Peter Barca, is here someplace. So the Wisconsin vaccination program is doing well. We're making history. Since December, we have more than 1.1 million people in the state of Wisconsin who have received the first dose. More than 650,000 Wisconsinites have actually been completely, fully vaccinated with 2 vaccines. 35% of those folks 65 and above have been receiving vaccines too in the state of Wisconsin. So we are really working well, and going forward it's going to be even better. Now Kenosha County, as you heard, is doing great things, and it's all the people here. National Guard, I want to, being the commander of the National Guard, I feel very special for me to stand here and congratulate you on your great work also. But all this happens because of great leadership and cooperation. And that's what we find in Kenosha County. They have helped us, as all the counties have helped us, become a leader in the nation and a leader in the region. Other states that surround Wisconsin are very jealous of the work that has been done here. And Kenosha County was the leader right from the beginning. The first shot was in December of this year. The same day they received the vaccines, they were putting vaccines in people's arms. Over 18%, or about 18% of Kenosha County folks have received at least one shot, and over 50,000 countywide. That's really extraordinary. I've had the opportunity to visit lots of centers, and that is really important work. And just going around today and witnessing what's going on, I hate to use this term, but it is a well-oiled machine. And we're talking about humans here, but it is a well-oiled machine. And from people doing the registrations online or over the phone and making sure they get here, it just doesn't happen by, crossing your fingers. It happens because people are working really damn hard to make that happen. And you can see the results, 2,000 coming through here in a day, and even higher going forward. So it is, and it was a pleasure for me actually to talk to some of those that have received the shots. Actually, in a very quirky way, my wife and I will be receiving our second shot today with our healthcare provider in Madison. And I talked to some today that have had his first and second shots, and it seems corny, but it is a relief. Any way you slice it, there's a lot of smiles that I saw in the back there with people getting those shots, and every shot that happens is potentially saving a life, not only their own but others that they might be interacting with. So it's a wonderful organization. Things are going well. Things are going to get even better. And so I just thank the folks of Kenosha for really doing the rest of the great work here. And going forward, we are ready. We are ready. Large facility here, but we're seeing this all across the state. People are gearing up and preparing for the end game. And the end game is making sure that everybody that wants a shot gets a shot. And we will do that. You heard the president talk about that last night. And we made the announcement yesterday that people with pre-existing conditions would be started in early or late March, and we also made the announcement yesterday that everybody will be eligible May 1st. We actually made that announcement before the President of the United States because we are a leader in the state, in the country, and we feel very good that the President agreed with us. I want to close by thanking some special people. First of all, critical partners, and certainly Mayor Antaramian has done his share. That's been a very trying and busy time for all of Kenosha County, and your work to help make this happen is greatly appreciated. And I also want to thank County Executive Cruiser. Obviously, for those of you who follow the news, that he is retiring next year, next spring, and he spent very many productive years representing this area of the state in the legislature, and also obviously 13 years as county executive. I told him I thought he was way too young to retire, but he disagreed. But thank you for your great service. Appreciate that. And finally, I want to thank Dr. Freiheit, and her staff. I can just tell you that going around the state, but also being part and parcel of the decision-making process here, the public health people in the counties are the heroes, and the heroes are all the people out here. Unfortunately, this has vaccination of people to save lives has become, it still is to some extent, a bit of a political struggle. And so for people to step up in the fray and say, this is what's right. You got to wear a mask. You got to stay socially distant. You got to avoid large crowds. You got to do the right things. That, and then coming in and saying, this is how we're going to resolve this problem. We're going to get a shot in every arm that we can possibly do. The people that work in public health, and Dr. Freiheit is one of those people, as is her staff, and all these volunteers are doing the right thing, and they've been doing it since the beginning of this pandemic, and frankly, it hasn't been easy. So if any group is the heroes, it's the public health officers and the people that work with them, and all the volunteers that are stepping up to the plate. So we're in a good position, folks. Things are looking up. We have promises to have more and more shots, and people are becoming more and more aware of the importance of getting shots. So my goal is to make sure that we get 90% of the people of Wisconsin with shots in arms. And if we can get 100%, we should. And I'm hopeful that those of us that get those 2 shots, and I'll be one of those today, as well as Kathy Evers, we need to be ambassadors too. We can be really happy about saving our lives and other lives, but we have to make sure those people that are hesitant around shots get those shots too. It's just as important for them as it is for us. So thank you very much, everybody. I'd be glad to answer any questions, and so will the folks that are standing up here with me.
Governor, we're seeing slowly Midwestern cities start to loosen restrictions when it comes to capacity limits, mask mandates. Wisconsin's expires on March 20th. Any plans to extend that mask mandate or start seeing restrictions?
Yeah, well, the only restrictions from the state level is our mask mandate, and actually ours expires in early April. There's some confusion there, but it's early April, and we'll look at the data as we have all the way along. The science, if the science tells us that things are plateauing instead of continuing to go down, we'll likely extend it. If not, we'll take a look at it. But we have some time, and we'll make that decision at the time. But we will follow the science. That's the bottom line.
Governor, is there any plans for expanding, obviously, vaccinations with so many people now suddenly being eligible within a month and a half time span? Will the state be ready?
We'll be ready if the federal government gives us the shots, and they've made that commitment. Obviously, the Johnson & Johnson with their collaboration with Merck, they will have hundreds of millions of vaccines available during this time frame. So it's our goal. I mean, this is a perfect example. The county coming here, creating a space, or creating this really special thing in a space that was not going to be used. They will be essentially practicing as they go forward, so that when we do need 2,500, 3,000, we can be able to do that. So I think this is a great first step, but it's our plan to, as shots come in the door, we'll get them out to the people.
Keep hearing how there's more demand than there is supply. Can you talk about the effort to just make sure the state can get it up and get it out to all the clinics like this one here to make sure everyone can get that vaccine that's needed?
Yeah, absolutely, and it's a team effort. We rely on the federal government. We're in constant communication with them every single day, as we are with most of the vaccinators across the state. We have a large number of vaccinators. I think right now we probably have over 600, maybe 700 that are actually putting shots in people's arms, but we actually have over 2,000 that stand ready. So I feel that the vaccinators are in a good place. We have a number of those. We have to make sure the shots are coming from the companies that the federal government has contracted with, and I believe it's going to be happening. I think as we go through this month, next month, it'll be slowly increasing until towards the end of the month, and it's really going to kick into gear. So I feel confident. I mean, in any situation, there will be bumps in the road. I mean, we could have a massive snowstorm next week, and it would stop the presses during that time. So people have to be patient, but we also have to make sure that people that want a shot at the end of the day can get a shot. That is really critically important.
Governor,
sites like this and Lambeau Field, not only does it help the just the regular cadence of getting people shots, but it also creates more awareness. It is an awareness builder, saying, hell yes, this is important. They're doing it at Lambeau Field, or they're doing it at Miller Park, or American Family Park. Got to get that right. But yes, I think it's very important, but it's equally important for us to provide shots to the federally qualified clinics that serve our migrant population that is now coming back into Wisconsin to do the work that they do every year, working with food processors. So all those from, the big cities to, a small rural town that has a large population of migrant workers that are doing really important work, putting food on our table. Because you'll have the large healthcare operations, Ascension and Aurora and others. They'll be scanning through their, the data that they have on every employee or every patient, and having the most serious people first. Now that is not everybody is in that situation, and so whether you're going to Walgreens or others, I think the sooner we get shots in people's arms, the better. But it is going to happen in some kind of sequence for those people that are already insured and are part of a system. The other ones will be working through Walgreens and others to do that, and we're not going to be policing that. Let's put it that way.
The President said 4th of July would be a time where we might be able to see small social gatherings. Is that a good date in your mind, or is there a different date that Wisconsinites may need to keep in mind?
Well, like I said, I think having a visible goal like that is really critically important, and I'm fine with that. But as I said, especially in spring, we could have a huge snowstorm that'll set us back, and then we're talking about August 1st or something. So I think having that in our mind and having that as a goal is good, but there will be bumps in the road, and there could be a snowstorm. But we just have to be happy that the supply is increasing, and we have all these great people helping putting those shots in the arm.
2 more questions. I have one for Jen, if you don't mind.
Yes.
75% is the goal for herd immunity. Any sort of timeline on when you guys, I know a snowstorm could come, but when you guys could potentially reach that?
Sure. Well, it's hard to say without knowing how much vaccine we'll get and when. However, we are very close to reaching herd immunity for our 65 plus population, so that's our first goal, and we were one of the first counties to reach 85% of our EMTs in the county, so we keep using the smaller herd immunity based upon occupation, and so we're very eager to get there. Our real big goal is definitely by the summer that we try to get as close to that as possible. Of course, that also depends on the children trials and when we can eventually vaccinate children. So, in childcare as well, and we have gotten a lot of them through, so we are very close to being able to get as many of them that want the shot through now.
How's the supply situation looking? Like, are you getting enough as a local health entity in terms of doses?
We're getting what we're getting, and we can always handle more.
Thank you very much, Jen.
Thank you.
Thank you all for coming today. Thank you, Governor Evers, for your strong commitment to the health and safety of our state and the cooperation you've been not only on this, but all of the facets of governor. You're very accessible, and welcome back to Kenosha County.
Thank you. Good to be here. Thanks,
Very good. Thank you all very much.
Thanks, everybody. Good job.
Thank you.
Oh, thanks.